The question, is fibromyalgia an autoimmune disease? An in-depth report on the causes, diagnosis, treatment, and prevention of fibromyalgia. Pain. The main symptom of fibromyalgia is pain. The pain can be in one place or all over the body. The exact locations of the pain are called tender points. Fibromyalgia pain is often described as video. How to reverse fibromyalgia now. Many experts believe that fibromyalgia is not a disease, but is rather a chronic pain condition brought on by several abnormal body responses to stress. Areas in the brain that are responsible for the sensation of pain react differently in fibromyalgia patients than the same areas in healthy people. Fibromyalgia has symptoms that resemble those of some rheumatic illnesses, including rheumatoid arthritis and lupus, systemic lupus erythematosus. These are autoimmune diseases in which a defective immune system mistakenly attacks the body's own healthy tissue, producing inflammation and damage. The pain in fibromyalgia, however, does not appear to be due to autoimmune factors, and there is little evidence to support a role for an inflammatory response in fibromyalgia. Studies report an increased prevalence of fibromyalgia among family members. Children and siblings of people with fibromyalgia are 8 times more likely to develop the condition than the general population. Family members are also more sensitive to pain, and more likely to have related conditions such as irritable bowel syndrome, temporomandibular disorder, or headaches. It is important to diagnose fibromyalgia as soon as possible, so treatment can be started. But because there is no clear method, such as laboratory or imaging tests, to diagnose the condition, as many as 3 out of every 4 people with fibromyalgia remain undiagnosed. It can take an average of 5 years to finally get a diagnosis. Because many patients do not meet the current fibromyalgia criteria, the American College of Rheumatology, ACR, has proposed introducing a new set of diagnostic criteria that take into consideration symptoms such as fatigue, sleep disturbances, and cognitive problems, in addition to pain. The WPI and SS scores are totaled to create a final score of between 0 and 12. To meet the criteria for a fibromyalgia diagnosis, a patient would need to have 7 or more pain areas and a symptom severity score of 5 or more, or 3 to 6 pain areas and a symptom severity score of 9 or more. The symptoms must have been present for at least 3 months. The 18 fibromyalgia tender points are located throughout the body. According to the American College of Rheumatology, a diagnosis of fibromyalgia requires widespread body pain plus localized pain in 11 of these 18 specific points. The healthcare provider will also examine the nails, skin, mucous membranes, joints, spine, muscles, and bones to help rule out arthritis, thyroid disease, and other disorders. Restless Leg Syndrome. About 15% of people with fibromyalgia have restless leg syndrome, RLS. RLS is an unsettling and poorly understood movement disorder that is sometimes described as a sense of unease and weariness in the lower leg that is aggravated by rest and relieved by movement. Check out the link below for a guide on long-term remission or to join in with the community.